My training to become an orthopedic surgeon has been quite extensive. I did my undergraduate training at the University of Texas at Austin, where I received a degree in biology, and then I completed my medical school training in Houston at the Texas Medical Center. I was very fortunate to obtain an orthopedic surgical residency in the Texas Medical Center, and I worked at a number of the various hospitals associated with the medical center. And then I was very privileged to be able to travel abroad to complete my training overseas, both in Melbourne, Australia, and near Bern, Switzerland. That training in particular was valuable in that I got to assist and observe some of the world's most famous surgeons in both knee surgery and shoulder surgery. And I think of all of the training that I received, that might have been the most valuable in my background. My particular practice focuses mainly on the non-operative and operative treatment of sports injuries, as well as on the treatment of knee and shoulder pain. And so I see athletes of all types and all ages. I've been privileged to be associated with a number of the high school athletic teams located here in our school district, as well as having had the privilege to treat a number of collegiate and even professional athletes. And so my treatment typically consists of an initial evaluation in my office. Typically, treatment does not involve surgery, which is fortunate for most of the patients, but when it does, I do a wide variety of surgeries, including knee arthroscopy, shoulder arthroscopy, ACL repairs, rotator cuff repairs, shoulder instability repairs, and so on. In addition to that, my practice encompasses a wide variety of different ages of patients, and so I frequently, on a regular basis, perform partial and total knee replacement surgery, partial and conventional shoulder replacement surgery, reverse shoulder replacements, and so on. And finally, my practice involves the treatment of a number of both knee and shoulder related fractures. So if a patient of mine falls and breaks their knee or breaks their shoulder, my background in training allows me the expertise necessary to repair that particular injury. Well, I think it's important for anyone looking for an orthopedic surgeon to be comfortable with the person treating them. And sometimes that relates to that particular physician's training and background. Sometimes it's a personality issue. Sometimes people refer to it as bedside manner. But regardless, patients have to be comfortable with the doctor they're seeing, because they're not going to see this person only once. They're going to see them repeatedly, typically over a period of weeks or months. So I try to make my patients comfortable when they come to see me in the office. I spend time examining them, listening to them, learning about their problems, carefully formulating a treatment plan, performing any necessary tests necessary to diagnose their problem, and then discussing with them all of their treatment options, which in most cases will include options for surgery or no surgery. And then once I'm comfortable and the patient is comfortable with the treatment plan, we go ahead and execute that plan. I have excellent office staff to help me and assist me in the follow-up of patients. And ultimately, in most cases, we're able to resolve the patient's problem, and not only that, become friends at the end. My decision to become an orthopedic surgeon evolved throughout medical school. I was always interested in surgery of one type or the other. During medical school, I was fortunate to have the opportunity to observe and participate in surgery with a number of different subspecialties, including heart surgery, brain surgery, ear, nose, and throat surgery, and so on and so forth. Actually, late in my medical school career, I developed an interest in orthopedic surgery. I found that it gave me an opportunity to successfully resolve the majority of problems that my patients presented with, and truly made an impact in their quality of life to an extent that I didn't see with other subspecialties. And because of that, I chose to apply to an orthopedic residency program. I was fortunately accepted, and from there went on to complete my training. I think it's very important that patients are comfortable with their doctor, and I think what differentiates me potentially from other physicians is that I'm very methodical and I'm very careful in my evaluation of patients, and I make every attempt to treat patients the way that I would want to be treated if the roles were reversed. And so I try to keep my patient's best interest at heart and in mind at all times. And so by doing that, I think that I am able to make patients comfortable with their treatment plan. I'm able to become comfortable myself that I've explored every option for evaluation and possible treatment, and eventually give them the best possible outcome that they could have under all circumstances. Well, we're very fortunate to have a wonderful office and a wonderful office staff, and my particular contribution to the advancement of technology, I think, would relate to my involvement with the research and implementation of various knee procedures. I'm currently involved in a multi-physician, multi-center study on the effectiveness of using partial knee replacements in the treatment of knee arthritis. I feel very fortunate to be involved in that study. In addition to that, I think that I and the other physicians in my practice maintain an active interest in ongoing technology and demonstrate that interest by traveling not only around the country but around the world to observe new procedures, to learn about new techniques, and when appropriate to apply those techniques to our practice. One example of something that I believe is truly cutting-edge technology is a recently designed custom partial knee replacement that we've been using here for about the past 2 years. This technology involves performing a preoperative CAT scan of a person's knee and then using that technology to generate a computer-designed and custom-designed artificial partial knee implant that can then be implanted into the patient's body. That gives us the advantage of having the patient receive a perfect fitting implant every single time and potentially increase the longevity of the implant and increase the effectiveness of the implant by relieving the patient's pain. That's something that's truly cutting edge, and I'm proud to be a part of it. It's always flattering to receive comments and compliments from patients. I think that's why I went into medicine, and in particular into orthopedic surgery. I had a patient tell me the other day that when she first met me, it was like meeting one of her neighbors, and I found that to be a great compliment because I want patients to be comfortable with me and to feel comfortable and to think that they're getting the type of treatment that I would provide a neighbor or a friend, and I was very pleased and honored to receive that type of a compliment.